Hi, I'm Garvin. This telecast is on Faverin. So Faverin belongs to a group of medicines called selective serotonin re-uptake inhibitors. It contains the active ingredient Fluvoxamine, which is used to treat depression and obsessive compulsive disorder. Faverin is available as a 50mg or 100mg tablet. For depression, patients should start on 50 or 100mg, given as a single dose in the evening. Dosage should be reviewed and adjusted if necessary within 3 to 4 weeks of initiation of therapy, and thereafter as judged clinically appropriate. Faverin should not be used in children and adolescents under the age of 18 years for the treatment of major depressive episodes. The efficacy and safety of Faverin has not been established in the treatment of pediatric major depressive episode. For obsessive compulsive disorder in adults, the recommended dosage is between 100 to 300mg daily. Patients should start at 50mg per day. For obsessive compulsive disorder in children 8 years and older, and starting dose is 25mg per day, which is half a tablet. Increase every 4 to 7 days in 25mg increments as tolerated until an effective dose is achieved. The maximum dose in children should not exceed 200mg a day. Patients suffering from hepatic or renal insufficiency should start on a low dose and be carefully monitored. Fluvoxamine tablets should be swallowed whole with water and without chewing. If your doctor advises you to take more than 150mg per day, do not take them all at once. The tablet can be divided into equal halves to reach appropriate doses. Side effects include agitation, anxiety, headache, nausea, sweating or dizziness. Occasionally, thoughts of restlessness, for example, you can't sit still, may occur or increase during the first few weeks of treatment. Tell your doctor as a dosage adjustment may be helpful. Fluvoxamine should not be used in the treatment of children and adolescents under the age of 18 years except for patients with obsessive compulsive disorder. Do not take this drug if you are allergic to fluvoxamine. Taking medicines called monoamine oxidase inhibitors or tizanidine. Talk to your doctor or pharmacist before taking your medicine if you've recently had a heart attack, have epilepsy, a history of bleeding, diabetes, mania, liver or kidney problems or glaucoma. If you're depressed or have anxiety disorders, you can sometimes have thoughts of harming yourself. These may be increased when first starting antidepressants. Since these medicines all take time to work, usually about 2 weeks, but sometimes longer. If you are having any distressing thoughts or experiences, it is important to tell your doctor immediately. So keep taking your tablets until your doctor tells you to stop, even when you start feeling better. Your doctor may want you to carry on taking the tablets for some time, for at least 6 months, to make sure that the medication has worked completely. If you missed a tablet, wait until the next dose is due. Do not try to make up for the dose you missed. You should not start to take the herbal medicine St. John's wort while you're being treated with Faverin, since this may result in an increase in undesirable effects. If you're already taking St. John's wort, when you start taking Faverin, stop the St. John's wort and tell your doctor on the next visit. If you've been taking a medicine to treat depression or anxiety in the last 2 weeks, or you suffer from schizophrenia, check with your doctor or pharmacist. It is important to tell your doctor if you have been taking aspirin, cyclosporin, methadone, mexillatine, phenytoin, propranolol, any of the triptan medicines, terfenadine, sildenafil, theophylline, tramadol or warfarin. Do not drink alcohol if you are taking this medicine. If you normally drink a lot of tea, coffee and soft drinks with caffeine in them, you may experience your hands shaking, restlessness or difficulty sleeping. A way to resolve this is to lower your caffeine intake. Do not take fluvoxamine if you are pregnant, unless your doctor considers it absolutely necessary. If you are currently taking fluvoxamine and are planning to become pregnant or father a child, please consult your doctor to decide if an alternative medication is necessary. Fluvoxamine passes into breast milk. Therefore, You should discuss this with your doctor to decide whether you should stop breastfeeding or therapy with fluvoxamine. So if you have any other questions, you can contact me through the live pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.